We strive for compassionate care. We strive to provide excellent care and compassionate care every patient, every time.
So I was applying to medical school in 2011 and I got a left-sided kidney infection, which seems like no big deal. I mean, treat it with antibiotics and it'll go away. It never went away. From there, they put me on intravenous antibiotics like every day, which ended up hurting my stomach. I had C. diff 4 times and it was just a mess. Took the whole kidney out. I was still getting infections, but not anything that I couldn't deal with, but I just could not keep anything down. A sip of water would come up, food would come up. So there was a much bigger problem than any infection, and nobody knew what it was. On the morning of February 29th, 2016, my mom had an intuition that I was going to die. She came and got me, and she ended up having to call 911, so I was brought by ambulance to Temecula Valley Hospital. I always had one doctor that kind of acted as all sorts of doctors. But I had, a cardiologist come in, I had pulmonology, I had GI, I had, my nurse practitioner. I mean, any problem that I was presenting with, there was somebody different to handle it. I met Dr. Chakrabarty probably 3 years before I got admitted here. He did a couple of GI tests that were ordered just to see if there was anything wrong with my abdomen, and they came up negative. So I had known him previously, but I hadn't seen him again until I was admitted here. So my mom took me to his office and he looked at me and he said, "Katie, you have to go." And I'm like, "No, nothing has changed. I don't want to do that." And he's like, "Please, I will help you. There's something wrong with you and we will figure it out." Nobody's ever done that for me before. It was always just, let's do this, let's do that. He said, "No, we will get to the bottom of this." So he did a series of tests. Some of them came back negative, and then he was like, "I wonder if you have SMA syndrome." I'm like, "Well, I don't know what that is," but so he's like, "Well, let's test for it." And sure enough, I did. All of this time I was suffering, losing weight, not able to heal, and there was a reason for it. At other hospitals that I had been to, everything was a rush, in and out, do whatever you needed at a minimum, and that was it. But here they made me feel so comfortable. They just had so much compassion, and that's something I had never seen before. I wasn't just another person in the bed that they had to take care of. They acted like they truly cared, and I believed that they did. You get to know these people like they are your family, like they are your friends. I would sit there, and if a code was called or something, you would just see all of the staff go and help, even if it wasn't their patient. Everybody was helping, trying to, save the patient. I did the whole pre-med thing, the whole college thing. Was set up to apply to medical school in 2011, and that's when I got sick. Dr. Ho is actually my mother's cardiologist, and she had, some cardiac issues, and she was brought to TVH and loved her experience here. And I think that's why I ended up here, is because she's had such a great experience. So when I was up on the cardiac floor every day, he'd come walking by, knock on my door, wave and smile, which was nice. When my mom went for her follow-up in his office, he actually offered me an opportunity to shadow him, which was amazing. I've always loved medicine. That was my plan since I was 7. And then, throughout my experience, I got really turned off against it. I was like, I can't do this. But being here and seeing that they never gave up on me, I just want to do that for even one person. If I could do that for one person, I'd be happy.
And the work we all do is meaningful. It's meaningful to the patients, it's meaningful to our employees that we interact with each day. And so that's, I think, part of the special piece of Temecula Valley.